Right now on WJCL 22, a yeast called Candida auris, which can cause severe illness, is once again in the health sphere, and it's catching the attention of doctors nationwide. WJCL 22 News' AJ Sisson spoke with Memorial Health and the State Department of Public Health about this deadly fungus.
It's called Candida auris, a drug-resistant infectious fungus that can grow rapidly and has doubled its prevalence in the United States every year since its discovery in 2016. The numbers from the CDC have not been updated for 2024.
We've had 4 people at one time on and off over the past few months. And in years past, it was unusual to have 1 or even 2 people with Candida auris in our hospital.
Our preliminary data shows that we have just over 1,300 cases in Georgia.
Candida auris, or C. auris, is a fungus that spreads easily through healthcare facilities by sticking to invasive medical equipment like breathing or feeding tubes or a catheter, and is also resistant to most household cleaning solutions and ammonia-based cleaners.
Many of the disinfectants that are EP registered that hospitals and other medical facilities have historically used are not effective.
Medical centers that have had a case of C. auris or use invasive medical equipment around Georgia use what the EPA dubs as Class P cleaners, specifically labeled to kill the fungus. And as it is resistant to most antifungal medication, it's difficult to treat.
It's almost like a cancer of sorts because the fungus will just keep getting bigger and bigger and obstruct certain parts of the lungs and cause problems that can cause secondary pneumonias.
Doctors are keeping a close eye on it for that reason.
If a person develops an infection in their blood, they're very difficult to treat. Now, it is good to note that C. auris is not a threat to the general public.
We have very strict protocols at our hospital to ensure that when we do see patients with Candida auris, that we use all those proper cleaning protocols to ensure that nobody else gets it.
In Savannah, AJ Sisson, WJCL 22 News.